Hey guys, Dr. Brotsky here. Welcome to week 6 of your pregnancy. If you haven't checked out the previous weeks, make sure you check in and do that. So right now you have a little embryo in your uterus. It's about as big as a pea size, so it's very, very small, but still usually able to be seen on an ultrasound. Believe it or not, the baby's arms and legs and limb buds are actually forming, so that's exciting too. Things you might be feeling right now are some nausea, you might be having some appetite changes. As I told you before, you may start feeling very fatigued and need more naps, and that's normal too. Bloating, constipation, acid reflux, all those things are very common in this stage. From a doctor's perspective, at about 6 weeks of pregnancy, we usually see a baby with a little heartbeat on the ultrasound, so that's always exciting. Make sure you save that picture for your baby book. The other thing you can expect at your first pregnancy visit is to establish a due date with your doctor. So believe it or not, ultrasounds done in early pregnancy are more accurate than the ones done later. So now's the time to establish your due date when we first see your baby. Also, your doctor's going to make sure that your pap smear is up to date. We also usually routinely do cultures for gonorrhea and chlamydia because the rate of those being undiagnosed is pretty high. So we want to protect these babies and screen everybody for that. Your doctor also may draw a set of labs at your first pregnancy visit. Typically, we check your blood type, we check your blood count, we do an antibody screen, which tells us if you have any antibodies to other blood types. What's also recommended is an HIV test, hepatitis B, and we do a urine culture as well as test for syphilis. So those are just routine things that your doctor is checking for. What you need to do right now is, because you're going to be less able to concentrate, you may want to make lists of questions when you go and see your doctor. You also, like I mentioned before, want to make sure that you know your insurance company's expectations as far as delivery coverage. Sometimes those can be surprises that we don't want you to have later. Rest when you need to, like I mentioned before. Take your prenatal vitamin every single day. And as usual, call for vaginal bleeding, severe cramping, or any fever, chills, anything unexpected. So thanks for checking out my video. You can always find me at drbrotsky.com and look for my other videos as well.